Good evening, everyone. Welcome to the New Teeth Now webinar. My name's Bianca and I'm here with Dr. Richards. And tonight we're going to talk about full mouth implants and all that New Teeth Now has to offer. Dr. Richards, did you know that it's been a whole decade since our last webinar?
Since last year.
Yeah.
Yeah, absolutely.
So we'll get to know a little bit about Dr. Richards. He's a board-certified oral and maxillofacial surgeon since 1982 and has over 40 years of dental implant experience and is the innovator of New Teeth Now.
That's right. We've been doing this a long time now.
Yes.
And really, it's hard to believe 40 years has gone by so quick.
So is every doctor board-certified?
Not every oral surgeon's board certified. Probably a greater majority of them are, but not everybody.
Okay.
And of course, that involves finishing a certified program, typically 4, 5, or 6 years after dental school, and then taking an oral and written examination to become board certified. Most hospitals now require a person to be board certified to maintain their staff privileges. And as you know, and both Dr. Kirkpatrick and I are on the staff at Lakeland Regional Medical Center and participate there in the trauma services. And so we do a lot of other things that oral surgeons do other than dental implants. We take care of a lot of broken up people.
So it's definitely important when you're looking for a facility to have a board-certified oral surgeon.
As a matter of fact, in that vein, occasionally we will see a person, as you know, whose health is not good enough to get clearance to do general anesthesia in our office as an outpatient. Yes. And we are able to admit those people to Lakeland Regional Health Medical Center, and we do the New Teeth Now procedure in the operating room at the hospital so that they get better care. They can't go home. They can't wake up and go home necessarily, so they spend the night in the hospital. So that's just an additional service that we offer by virtue of being on the staff out of the hospital. So
that's awesome.
That's kind of nice for people whose health is kind of on the borderline for an outpatient procedure.
Yeah, that's awesome. So we'll jump right into what a hybrid is. Can you kind of explain the different parts and pieces in this photo?
Well, there's two types of teeth that generally would be attached to implants in a fixed fashion. In other words, fixed would mean that the teeth do not come in and out. That would be removable. But most of what we do is fixed. So this is fixed, it's upper, it means it's the upper jaw. And a hybrid type of a prosthesis is a prosthesis where the position of the implants and the position of the teeth are totally disconnected. A lot of the people that have these types of prostheses have a lot of bone loss, and it would be impossible to place the implants tooth site specific. So it would be very difficult, if not impossible, to provide them with crown and bridge type implant work. And so the hybrid type work works very well in those situations where there's been a lot of bone loss. And you can see in this picture, you sort of have Superman eyes, so you're seeing through the tissue, through the bone. You can see the implants. There's 6. Typically, with the New Teeth Now procedure that we do, the upper jaw, typically there are 6 implants in positions similar to what you see in this illustration.
And then the lower
is similar. And then the lower is just a very similar situation. Typically there are 4, sometimes 5, 6, or 7 implants, depending on the available bone, depending on the position of the nerve in the lower jaw, and just depending on the size of the jaw and the amount of room. You can see in this illustration how the implants are spread out. And you can't really jam the implants up next to one another. There needs to be a sufficient amount of bone in between the implants so that bone can be healthy. And so this illustration would be sort of a setup that would be typical standard of care on a worldwide basis. 4 implants, positioned like that, in between the nerve foramen, where the nerves come out of the jaw. So that would be typical.
And so we'll kind of go over the what we do here, the new teeth now procedure. So our patients are under general anesthesia, so it's completely pain-free. They go to sleep, they wake up, and the surgery is completed. The second part of it is we'll start with extractions. If the patient has teeth, they're extracted, and then you would place implants, typically 6 on the top, 4 on the bottom. And while the patient is asleep, the lab upstairs, so we have a lab in-house, they will take impressions for the lab you will take the impressions for the lab to customize the teeth.
Right.
And then when the patient wakes up after surgery, they rest in the private recovery room while our in-house lab creates the teeth for them. Right. And then before they leave, the same day of surgery, the teeth are placed in the patient's mouth and adjusted. So they go home with a temporary set of teeth.
That's exactly right, just as you stated it. Yep. And I particularly like this slide because it shows the business model that we have that Bianca just described, where the surgeon, the dental lab, the restorative dentist, we're all in this office.
Right. And
to make the new teeth now procedure happen, it is an interaction of all three. Whereas in a standard type business model, the person would go to the surgeon's office, which would be separate from the restorative doctor's office, and then they would interact with a lab that's in a different location. And so you just don't have everything all in one place, and these are sometimes complicated procedures, and to have everybody in one place on the day of the procedure just takes all the stress off of everybody, because
there's no miscommunication. Everyone's
we're
right
all
here.
there. We can handle if any little issues come up. The technicians are there. Dr. Dibbs, the restorative dentist, is there. And the lab is in-house, so we can do whatever we need to do.
Yeah, it's really amazing.
Yeah.
It's a great benefit to our facility. And this is our facility. So this is our it's quite a big facility, actually.
Yeah, it's pretty big, I'd say. About 15,000 square feet. And, it didn't happen overnight. The original facility, which you see in the foreground behind the palms, is about 7,500 square feet, and that we opened that in 2002. We had a couple of operating rooms, and then over time, as we outgrew that facility, we actually had a lot in the back for sale, and boy, are we glad now that thing didn't sell. Because we put a 2-story facility back there, which has 2 major operating rooms where we do other things other than dental implants. And then upstairs is the prosthetic center where Dr. Dibbs, our restorative dentist, lives, and the laboratory as well. So that vacant lot that we sat on for years has certainly turned out to be a worthwhile
addition.
Situation. Yeah, we opened the lab in that other wing in 2013. I mean, it is hard to believe that was 6 years ago. Time just has passed quickly.
So here is Pam. She's one of our patients at New Teeth Now, and she's actually also a dental lab technician.
Right. Works
so
for us.
Yeah, so she suffered from a lot of dental problems, and so we're just going to hear a little bit about her story and why she decided to have New Teeth Now.
I am doing these beautiful makeovers on everybody else, but my teeth are a mess. And how good am I, how effective am I going to be with patients with the problems that I'm having now? I would like to be able to look at patients and doctors and everybody in the face. And that's when I thought I got to do something. And the pain is getting hard. Because you are in pain. When you have not a full complement of teeth and you try to eat something like a potato chip is like a exercise and tear. It hurts. I don't smile. I don't date. I have one granddaughter that's given me difficult about this. she tells me I don't smile. And then I smiled real big, and she knows why I don't smile. And that doesn't make me feel good. I want her to be proud of her grandmother. Being able to smile whenever I want to and not have to be guarded is probably going to be the best part of it. And I know Dr. Richards, and I know his team is going to do a wonderful job on me. And to be able to wake up and smile is going to be a great thing.
You got to see a little bit about Pam, and later on we're going to hear how she's doing now post-surgery. And so we're just going to answer a few questions that have been coming in.
Yeah, one of the viewers asked, how do we make sure the temporomandibular joints are in place after doing so many changes? And when a person is under general anesthesia, the muscles are relaxed, and so I can hold the jaw and manipulate and actually rotate the jaw on the ball and socket, and make sure that the teeth come together properly while the balls are seated in the socket properly. So it's actually easier to make sure that the joints are in place when a person is under general anesthesia, because you're not having to fight the muscles.
Right.
So that works out really well. There was another question, Jason, about what time is the appointment?
Yes.
And most people get here about 7:15. They will get them checked in. They go back with the anesthetist, and you'll see our anesthetist here a little bit later in the presentation. And the anesthetist makes small talk and interviews the person, and re-reviews the medical history and all the clearances that we will have obtained prior to this visit. And then gets the person changed and anesthetized. And then it's usually about 8 o'clock. And then we prep the person and drape them sterilely. And so the actual procedure typically wouldn't get going until about 8:30. Mm-hmm. And a typical double jaw procedure will last 4 hours. Then all of the records go up to the lab, and the teeth are typically ready around 4 o'clock in the afternoon.
Right.
So the person is recovering with either Teresa or Jody in a private recovery room. Once they're awake, their family member comes back if they want them to, and if the family member wants to. And then we move them to a treatment room and put the teeth in.
Right.
So the person is here all day from 7:15 until 4:30, 5 o'clock. I hope that answers that. There was one other question about the level of pain, and I'm going to look right in the camera lens and tell you there's not a lot of pain with this procedure. You'll hear it from Pam. Quite a few people get by taking a combination of Tylenol and ibuprofen together. Some people take 1 or 2 codeines, some take no codeine, but typically speaking, this is not a procedure that causes a lot of discomfort. Pam, in her post-procedure little interview, will address that.
Yes, it's surprising, but
Yeah,
not a lot
it
of
is
pain.
surprising.
Really, it's not.
So we're looking at a slide of sort of a traditional look of a post-operative x-ray. Mm-hmm. And you can see how in the upper, those implants on the far left and the far right, both top and bottom, are tilted, and they're tilted to avoid anatomical regions. In the upper jaw, they're tilted to avoid the sinus, and in the lower jaw, they're tilted to avoid the nerve. Once again, these are techniques that are employed all around the world. This is just sort of typical, traditional.
Right.
Everyday bread and butter type stuff.
And this is for someone who has an adequate amount of bone.
Adequate amount of bone. Right.
So for someone who doesn't have a lot of bone, like if you, the viewers who are watching, if you've been told that you have no bone for implants, we have a procedure that can actually do that without bone grafting. And those are zygomatic implants.
So we've been doing zygomatic implants since about 2006 or 7. Both Dr. Kirkpatrick and I do a lot of zygomatic implants. We do a lot of procedures where a person would get one zygomatic implant on each side. If they have normal bone in the front, they would get traditional implants in the front and a zygomatic implant on each side in the back in the molar area. But somehow people find us that have no bone in the front, they have no bone in the back, and we do 4 zygomatic implants. and sometimes find a little bit of bone to put some short implants in addition to the zygomas. So we do some creative stuff with zygomas. I think our last count, maybe we had done almost just short of 2,000 zygomatic implants over the last 8 years or so, or 10 years,
wow.
maybe 12 years, because 07 and 12 is 19. So we do these routinely. Some weeks we'll do, between the two of us, we might do 20 zygomatic implants.
Yeah, you guys have been doing them a lot lately.
A lot
almost
lately.
Every
It just seems
case.
like lately every person we do
Yes.
gets a zygomatic implant. So we've got another slide that's an illustration, and you can see on the far left there's bone only for 2 zygomatic implants on each side, whereas the picture in the middle, there's a little bone up front for 1 traditional implant with 4 zygomas, and the illustration on the right is like the picture that you saw previously, where there are 4 zygomatic implants and 2 traditional implants in the front. And I mean, if you can do like the middle picture or the one on the right and get a couple of little traditional implants and to shore up those zygomas, that really is the cat's meow, so to speak, for the person who has no bone.
No bone.
Yeah.
And every patient's different, so it's just the matter of the combination of all of that.
Right. And this term zygoma, you can look at that on the computer, but the zygoma bone is this cheekbone, and it forms the lateral wall of the eye socket, sort of the lateral inferior part of the eye socket, and it's the prominence of your cheek. And so when there's not enough bone in the rear part of the upper jaw because of the sinus, then rather than do a sinus graft and wait for months and months for the sinus graft to heal, to put implants in, we just go to the zygoma implant, which does not require bone grafting.
Right.
They are very stable, very predictable, and relatively trouble-free, as long as you don't have sinus disease. So for people that have sinus disease, we recognize that, we see that on the CAT scan, and we send those people to an ear, nose, and throat doctor to get their sinuses optimized before we do the zygomatic implants.
So we got another question in. How soon can you eat normally?
You know, I guess that depends on what you normally eat. People who have a set of these, first set of teeth, these acrylic fixed in place teeth, they can eat food such as pasta, cooked vegetables, fish, meatloaf,
Baked
homemade
chicken.
hamburger patty. And so for some people, that is normal. Things that you would not be able to eat would be Cuban bread, pizza crust, hard meat like pork chops, where you got to kind of tear it off and really gnaw on it, because what will happen is you'll break the teeth. So the diet afterwards, I would say, is fairly normal. It's just kind of easy to chew normal rather than a hard to chew normal.
Right.
Yeah, and we tell people if you can cut it with a fork, then it's okay to eat it. But nothing that you really got to bear down on. It would be easy to chew stuff.
So that's your first set of teeth, and then 6 months later, once you get your finals,
Right.
then you can eat the apple and the steak and all those things
Right.
that are harder to chew.
Right.
So let's look at your team. We got a couple new team members a couple months ago.
Right. I have a team. Dr. Kirkpatrick has a team, and we each have 4 gals that work with us. They're all very experienced. These ladies play with implants and implant screws and implant teeth and drivers probably more in 1 week than most dentists do all year, because every day we're doing one of these procedures, and then every day we're seeing post-ops and checking those people and checking screws and parts and pieces. And so these gals, I just can't say enough good about them. They could run circles around most dentists who dabble in implants. These gals, they're smart, they're well trained because I trained them, and they know what's going on.
And this
Without them, I couldn't do what I do. I can't say enough good about these ladies that work for me and work for Dave.
Yeah,
they're
incredible.
top notch, top shelf.
And that's the team that you would see every time you come in, or every time a patient would come into
Right.
the office. That's who they'll
Right.
see with you. So we're going to look a little bit at our anesthetists. We have Jack and Kim. They both have an immense amount of anesthesia experience, 30 years and over 25 years.
Right. So a CRNA is a certified registered nurse anesthetist, and they are all RNs first, and then they're RNs that did a lot of critical care medicine, and then they go back and they do a 3-year training program for nurses to be trained under the tutelage of an anesthesiologist to become a certified registered nurse anesthetist. And so when we're doing general anesthesia, we're concentrating on the procedure, and so the anesthetist does the anesthesia. It's not one of those things where, like wisdom teeth, where we do a sedation for the patient and take the teeth out, and I do that with my team.
Mm-hmm.
When we're doing these procedures under general anesthesia, it requires an anesthetist to manage the anesthesia.
And
these are, as you said, highly trained, highly experienced.
yes, they're great.
People.
And this is always a good question. Why do we always do it under general anesthesia? Why is that so much better than IV sedation?
Well, I can do a better job for you under general anesthesia. I can clean things up better. When I'm drilling on the bone, which generates heat, I can use a lot of sterile saline coolant without having to worry about you choking and gagging on something that we're squirting water into your mouth while you're sedated and have you like swallow down the wrong hole kind of thing. So when you're under general anesthesia, your airway is totally protected. We have a lot of little drivers and screws and pieces and parts that are going in and out of the mouth. You don't have to worry about anything dropping down your throat and swallowing it or aspirating into your lungs. Your airway is totally protected. And if you're drilling on a piece of wood at home, this is something that I don't think a lot of dentists pay attention to at all. If you're drilling on a piece of wood at home with a drill and you touch that drill, it's hot. But it doesn't matter because that wood is a dead piece of stuff. But when you're drilling on a person's bone, now you're talking about living tissue. And living tissue will only stand so much heat. And so when a person is under general anesthesia, we can pour the coolant to the drill. And we use a ton of coolant
That's a good way
when we're drilling, and we don't have to worry about the person choking because we're squirting coolant on the drills. If a person is sedated, now their reflexes are slow and you're squirting water into their mouth and they tend to choke and gag, and the general anesthesia allows the surgeon just to forge ahead, get the procedure done quicker. The person is totally comfortable. It's like the light went out and 4 hours later the light comes on. You have no perception of time. You're done and totally comfortable.
Right.
So I cannot say enough good about general anesthesia. Since we transitioned to general anesthesia 7 or 8, 10 years ago, it's just made our lives and the lives of our patients who have these procedures so much better and so much safer.
So this is Dr. Dibbs. He's one of our restorative doctors here, and we're going to hear him talk a bit about the lab and what he does and how we all work together.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. and we need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
You got to see a little bit about the dental lab, and this is our in-house dental lab team. Those are our master artisans. They're the ones who are working on teeth every single day, and they're truly amazing. And it's awesome that our restorative, like Dr. Dibbs, can walk across the hall and work on anything, and they can come and see the patient for different customization options. And
so as you're listening to this, and you've seen, I have a team of people, Dr. Kirkpatrick has a team of people, we've got anesthetists, this is the lab team. Just think how many people are involved in pulling this off.
It's a lot.
You got a lot of people involved with pulling this off in one day. And we do this every day. And so this is what we're set up to do. We do 300 of these a year. And it just, seeing this presentation and seeing these different teams, these surgical teams, the anesthesia team, the dental lab team, the restorative dentist. I mean, there's like 20 people it takes to pull it off.
Yeah.
So, that's who's taking care of you.
And we'll just show a good comparison. So the final teeth that you get are zirconia, which is that top set of teeth. And those are like the strongest material that you can get. And those are resting on a set of upper acrylic teeth. So both of these have been worn for 5 years, and you can like immediately see the difference in the wear and tear of the acrylic versus the zirconia. So that's why we use zirconia. They're just a much better material.
Right.
And then these are our implant coordinators, Shauna and Debbie. They are fabulous, and they will help you through the whole process. So when you come here for a consultation, that's who you're going to sit down with, along with Dr. Richards or Dr. Kirkpatrick. And they answer all your questions. They make sure that your process is going to go smooth and basically helps you out through the whole process.
Right. And so that's just 2 more people added on to everybody else that you've seen. These are the ladies who interview you. They're the ones who coordinate all the medical clearances, all the lab work, EKGs, appointments, help with finances. Very knowledgeable. They both have many years of clinical experience. Both of these ladies, both Shauna and Debbie, have been surgical assistants. And so they have a depth of knowledge of the entire thing. They're not just like salespeople. I mean, they really know what's going on. And they're your gateway in and your gateway through. And Shauna and Debbie are very friendly and personable, and actually kind of develop relationships with people. It's kind of surprising. But you couldn't have a nicer couple of gals helping you through the process than these 2.
Yeah, they're great. And they also will help any out-of-state patients, even like with smoothing their logistics of traveling too. So they're just helpful with everything. And so at your consultation, you will take an open CT scan, and that basically going into the next slide, you'll be able to use that CT scan to finalize the treatment plan with the doctor.
Right. Bianca said something a while ago about people coming in from out of state, and we're beginning to develop some networks really around the country. If you came down here from Atlanta, you'd probably save a ton of money coming down to Lakeland to have this done. We have restorative dentists in Atlanta who can do post-op checkups, so you don't have to come back and forth every single time for a post-op checkup. We have I did a procedure on a guy that lives up near Richmond, Virginia. We have a restorative dentist up near Richmond, Virginia, who also can do post-op checkup visits and save people a lot of travel time. So we're beginning to see more and more people come in from out of the area because they find that our fees are so much lower than what they get quoted in some other areas of the country that it's worth their while to
make the
come up,
trips.
to make the trip down here. Yeah. So I guess we're going to hear a little bit about Pam's after experience.
Yeah, so I mean, you can already tell she's smiling. It's this was filmed 8 days after her surgery, so definitely notice that change only 8 days later.
I had the new teeth now procedure done 8 days ago. Oh my God. A smile means so much. People do not realize how much it means or how much they miss it till it's gone. And I missed it so much. And I have it back. And I love it. No swelling, no bruising. I think I look pretty good. I have a great smile now. It was very easy to do. And I feel so much better now. I think for some people our age, it's really hard for us to think about doing something for ourselves on this scale. This is just going to keep getting better.
Have you seen your neighbor in front of the house walking his dogs?
I saw him Sunday. I gave him a dazzling smile. And it was nice. I think I'll see him again. That is such a nice thing for a woman my age. I just didn't think I was going to have these feelings again ever in my life. Every day I'm so thankful. Every morning I get up and go to my bathroom and look at the mirror and give that little smile and wink because she's back.
So as you can see, she is just so much more confident, and she's getting back on the dating scene and everything. So it's really amazing to see her transformation.
A lot of people really do a makeover on themselves, and it's fun actually to watch that.
It's amazing you get to be a part of it.
Oh yeah. Hair, makeup, contact lenses, new teeth. I mean, it's brings the that inner personality out for sure.
So we will kind of see a couple more patients and see their before and afters. So this is Krystal, and she had painful loose teeth. She was tired of covering her mouth, but now after new teeth now, she's laughing and smiling and talking to new people, and it's just a whole different lifestyle for her. And then this is Gladys, and she's from Tampa, and she had difficulty chewing, she had infection, and she had embarrassment with her teeth. And when she researched all her options, she decided on new teeth now, actually specifically because we placed our patients under general anesthesia. And she just looks so much younger now, don't you think?
Yeah.
Yeah.
You know what you said, a lot of people tell me that, the general anesthesia, that
was their deciding factor,
yeah.
And then this is Bruce. He's over in Orlando, and he also had pain. He couldn't eat the foods that he loved, and that was really important to him. So now he can eat, everything that he wants, and it's made a big difference in the quality of his life as well. And then finally, we have Karen, and she's one of our out-of-state patients.
Right.
So she came from Pennsylvania. There wasn't actually a lot of facilities even up there to choose from.
Right.
So she decided it was better to come down here. And she had a lot of teeth issues. She had an upper denture for 15 years. Her bottom teeth kept shifting. And she also had extreme dental anxiety. So we actually interviewed her about a month ago, and she said how like the sound of a Dremel would make her completely freak out and have
Really?
such
Yeah.
anxiety. But now when she's here after the procedure, she can hear that
Yeah.
and she's fine.
Yeah.
So it's really amazing how a good experience can fix everything.
Yeah, she came down here by herself.
Yes.
I mean, you talk about, that's something.
No, she really wanted it, definitely. And now she's completely confident in her job. She has her own YouTube, and she's confident in speaking in front of her audience. So it's really good.
Yep.
It's really good for
Yep.
her.
And we've met some incredibly nice people.
Yes. So if you are interested, I think that it would be great for you to give us a call. We can answer all of your questions. If you want to come in and schedule a consultation, just talk to us. Give us a phone call. We really want to help. So our number is 1-800-615-5838. If you have been with us for the last hour, you've definitely been listening for a reason, and this is probably something that you need or you need to research or look into a little bit more about. So we just want you to give us a call. We just want to help and answer all your questions, make you feel comfortable. But we thank you so much, Dr. Richards, for being here.
Thanks for joining in tonight.
and
Hope
he-
it was helpful. And, you know, if this generates questions, all you got to do is call our number.
Yep.
And we have several people that answer the phone that could give you further information.
Yes, so he's able to restore your total health and happiness. But yeah, we just thank you for joining us tonight, and we hope that everyone has a wonderful evening.
Good evening.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.